So the presentation today, the project that we just finished in the last semester, the title is Happy and Healthy Life in Sydney. So that is the research team. I got myself and then another medical doctor, Dan Fong Lim, and he is from the Medical Association in Australia. Okay, and this project is funded by Cancer Institute New South Wales, and actually this project, the funding is for two parts. So one part is in the Chinese, and then one part is in the African Australian women. But today's presentation is just more focused on the Chinese community. Okay, so the aim of this project actually is a community partnership program for promoting cancer awareness and screening practice among Chinese and African Australian women. So when we talk about screening practice for women, this program is more focused on pap smear and mammogram. Yeah, so we talk about breast cancer and cervical cancer, and the screening practice we focus on pap smear and mammogram. So this project have two aims. So the first one is to develop and implement a tailor-made, culturally sensitive and linguistically appropriate cancer awareness program for promoting cancer screening participation. And the second part is to train a number of community health advocates to continue the ongoing educational work in cancer screening practice. So maybe I give you some background information about cancer, the cancer topics in Chinese. So in Chinese culture, so cancer carries stigma image. Okay, so for example, Chinese people, if they got cancer, they don't want to share with friends. They don't want to tell people because it carries a stigma image. I remember when I did my PhD and then go out to interview some Chinese women with breast cancer, and they really worry to tell people because of this stigma image, as people will isolate the cancer patients as they believe cancer is contagious. So they don't like to have meal, together with the cancer patient as they believe it's contagious. And we have that in my family when my mom, got breast cancer, and mom is not us, but mom will try to separate the meal, because we believe cancer is contagious. Of course, we know it's not. And we believe cancer is sort of fate. If you are meant to get it, you will get it. So it's no point to go for early detection or screening. Okay? And some myth and misconception about cancer screening is they believe if no sign and symptoms, and it's no point to go screening. As we in Chinese culture, we believe more in health rather than looking for disease. So when they feel all right, no symptoms, they can't think of any disease that may happen in the body. Or the other very strong belief is negative thinking brings negative thought. So they believe if you go for screening, that means actually you catch the disease by attending the screening because you think about it and you have that in your mind. So as you can see in these figures, so in this project we have two phases. So the first one is the cancer education and information. And under this arm, we have conducted a number of educational seminars, yes, and we have developed a take-home information kit. And also in these materials, we also developed some pamphlets and posters. Okay, we have these posters and pamphlets available in all those ethnic organizations and GP clinics. So even though when we finish the intervention, so all these materials still available in the Chinese community that to carry out, to keep the educational message going. And I can see you the material we developed. Can you see it? So this is the booklet. So in this booklet, we have put the information about breast cancer and cervical cancer in this little booklet. So you will see in here, and we use all those Chinese image, and all these messages are in a simple words, and also the how to address the myth. For example, how important the early detections. And parts of the material we have fridge magnet. So they can stick it in their fridge, and then to remind them when they have done the screening, and then and also got the information how to book the appointment to do a pap smear or the mammogram. And also we have a poster we developed. So that is the poster that's now all in the Chinese GP clinic. So reminds them how to book a mammogram, and then what is a pap smear. Yeah. Okay. So, and then the second phase of this program is to train and patient and community health advocates. So what that means is, in parallel to the educational program, we give some training to the ethnic organizations, the leaders or the workers, because they are the frontline workers who work with the women in the community. So they can carry on, the message even when the intervention finished. And today, I'm just focusing on the results of phase 1. Yeah. Okay. So when we talk about culturally sensitive strategies, so what we have employed is the first one, that we have some Chinese cancer survivor and screening participant to share their experience in educational educational seminars. So that will associate their thinking that breast cancer could happen in Chinese women. As one of the belief is, a lot of Chinese women, they believe breast cancer is only happen in Caucasian women because they have a bigger breast and they are more prone to breast cancer. So when we have a Chinese cancer survivor, so that associate the thinking that breast cancer can happen in Chinese culture. Okay, and then we did a lot of promotion of the program through the ethnic media. We used the Chinese newspaper, the radio, and the community channel. And all those materials and the program was conducted in Cantonese, and all written materials are in Chinese. And the more important for that is all those educational seminars are conducted in the Chinese community organizations. So in terms of the evaluation, we in these studies we employ the pre and post test to assess the changes in the knowledge and attitudes and belief about cancer and screening practice. So before the intervention, we got the participant to fill in the pre-test questionnaire, which is the pink form. We asked them to fill in the form, and then after the intervention, we asked them to fill in the same questionnaire, which is we work it at blue, and also the program evaluation. Yeah. Having the take-home information kits, we found that is a very good incentive for them to fill in the questionnaire. As we said, if you fill in the questionnaire for us, you will have a little gift, to take home. Yeah. Okay. So we are quite lucky that we have conducted the seminars in 7 venues. Okay. So. But for 7 times in 7 venues. So in total, we got 288 participants. So it's ranged from 5 to 82. I remember that 82, how it comes up with 82 is we arrived early and the women actually were doing their Tai Chi sections before our educational sections. But when they saw all those bags, they stayed there for their seminars. So actually we run out of the materials in that time. So that is how it ended up 82. We were so impressed. Okay. So this is the demographic backgrounds of those 288 participants. Okay. So you will see the age range. Okay, it's from 30 to older than 70. But you will see actually the majority of these. Okay, is between age 40 to 69, which is what we want because that is the target age for mammogram and pap smear. And one of the reasons we have this age range is the women, they went to all these ethnic organizations. They are more likely the housewife, and it's not that they don't have things to do, but they don't need to work, or they are full-time housewife. They got time to do these kind of activities in the Chinese organizations. Yeah, and in terms of the country of birth, and that is not really surprising, as half of these are from China and half of these are from Hong Kong. Yeah. Okay, and in terms of length of stay, you will see the majority of them has been here for more than 10 years. Okay, more than 50% of the participants, they have been in Australia for more than 11 years. But you will see, it's no association with their English proficiency. So it's no associations. Even they here for long, for more than 10 years, but more than half of these, they can't, speak average English, or they just speak a little or not at all. So when it comes to health information, you could understand, they really, don't understand, the local health informations. Yeah. Okay. So in terms of the screening practice, okay, maybe I read through the results for the stuff that you can't see the PowerPoints. So in terms of the mammogram, okay, we have 50% of the women who are aged over 50 to 69 have performed mammogram every 2 years. So that is what we recommend in the current health message. Okay, and in terms of the pap smear, okay, and in this sample, we got 42.7% of the participants, they have performed pap smear as recommended, which is, every 2 years. Okay, and this 50% and 42.7%, which is far below the national data. So I think in the local data is about 70%. Yeah. Okay, so you see that is a problem in the Chinese community, the screening practice. And so this is the result. That is the question we asked them pre-test, before the intervention and after. So the first one we asked them, breast cancer is the leading cause of cancer among females in Australia. And the second one, breast cancer is like a death sentence. If you got it, you will surely die from it. And the third one, if a woman feels well, she doesn't need to worry about getting breast cancer. The fourth one, if a woman has no physical signs and symptoms, there is little change that she will have breast cancer. So this question is from the questionnaire I have developed earlier as an instrument development. The data, we got it from the qualitative studies, and then we validate these questions are valid for assessing the belief about breast cancer. And the results we see, in the first 3 questions, we have a significant result. So before and after, they have a significant change in their belief in terms of, the breast cancer belief. Yeah. And in terms of the cervical cancer, we do ask them 4 questions. The first one is cervical cancer can be cured if detected early. The second one, only women who have more than one sexual partners will get cervical cancer. The third one, women who have been through menopause will not get cervical cancer. And the fourth one is thinking about cervical cancer will cause it happen. And the last one is women who have had sexual intercourse will need to have pap smear tests regularly. And again, we got the first 3 questions have a significant result. Yeah. And in terms of the program evaluation, the majority of the participants, they really like the program because they found the information is easy to understand, and it's in their language, and it's in simple terms. And they found the explanations and examples presented in the program were useful. And you see nearly 5% the participants, they strongly like the program, or they strongly agree that the program is useful. And yeah. So it comes to the conclusion. We found the program design has been effective in addressing cancer myth among Chinese Australian women. And the model we use, we prove that is useful and practical and culturally sensitive in Chinese Australian communities. And the last thing I want to share with you is the lessons that we learned from this project. And we found working with the ethics organization is the key to recruit sample, to promote and implement the program. But we found the downside is the ethics organization sometimes they are not really fully support in terms of resources. And some of these they found, having this kind of program is giving them, extra work. Yeah, and when you work with them, you need to work around their schedule, and sometimes it's out of your control. Yeah, also, yeah. And having, as I mentioned earlier, having a take-home information kit and catering is a handy incentive to attract the participant to come to the program and also fill in the questionnaire. Yeah. And the last one is a big lesson for us, which is we actually at the beginning of the research, we underestimate the time, for producing all these materials. Yeah. Because all these materials, the message in the booklet, we need to make sure they are consistent with the current message that they promote in Cancer Institute. So I couldn't remember how many emails come and forth between us and Cancer Institute, and also the design, the production design who designed this the material for us. So I think it's a big lesson for us. With the production of the material, but we found that is really worth, because even though the intervention or the project finished, and we still have all this material available in the ethnic organizations and the GP clinics, and then the message still can be carried out in the communities. Yes, that's about my presentation. Thank you. Sorry for the other two campus. I found maybe it's a bit hard to understand those materials, I think, yeah. At the moment, our team are, preparing the publications, as we are quite surprised that you get these statistical results, though. So, any questions?
What are you going to be doing next?
Honest, I don't know. To me, I have conducted similar project for 3 times now. Yeah, and I found this area has been a bit saturated. Yeah, so actually I'm now extending my research interest into the Chinese cancer survivors. Okay, so we have conducted a similar, pilot studies for the cancer survivors in Chinese community. So we have conducted some culturally sensitive cancer support group for them. They found this really useful, and that tailor their needs. So the next one, I'm thinking to develop some culturally sensitive materials, but for the cancer survivors in Chinese community. Yeah. Yeah.
Are there projects like that in China though, or in Hong Kong? Could it be rolled out over there? Or? No?
I don't think so, because in Hong Kong, all the materials they're in Chinese, and so they can see the advertisement and the promotion, in Chinese. So they don't have the language barriers in there. Yeah, the problem in here is the language, mainly is the language barrier. Honest, all these women, they heard about breast cancer, they know, they receive all these booklets and the pamphlets, but the problem is they don't understand. And also they believe breast cancer is more happens, with the Caucasian women, so they can't be worried. Yeah. And also with cervical cancer, the problem with the women is they believe if they have one husband, if they are loyal to their husband, they don't need to worry about getting, cervical cancer. That is a misconception. Yeah. So.
Can I just ask, did it help you, being Chinese yourself, going into that community? Would have obviously helped.
Yeah, of course,
Building that trust relationship.
Yes, correct. Yeah, that's why I think that is the benefits. I'm, having this research area, having my ethic, background in Chakhans. Yeah, of course, and also, as I said, working closely with the ethic organization is the key point to, to be successful in this kind of activities. Without the ethic organizations, have nowhere to recruit the samples. Yeah. But and then another downside is, honestly, I work with these ethic organizations since, when I did my PhD. I just feel a bit, overwhelmed them whenever I did my studies, I have to, we could, sometimes, will be overload the samples. You see what I mean? Yeah, yeah. That is not something that we want to, overload them. Yeah. Yeah.
Are the breast cancer and cervical cancer rates in Chinese women the same as Western women? And when they detect it, because they don't come for screening, is it worse at their first, presentation?
Yeah. So what we have is breast cancer, the incident rate of breast cancer in Chinese communities, Chinese women, yes, correct, is much lower than Caucasian women. Yes. But the thing is, it still remains the most common cancer in Chinese, the first one. The second thing is, after migration, all these Asian women, okay, for example, Chinese in Australia, after migrations, the chance of getting breast cancer, which is 40% more than our counterparts in China. So that happened to all Asian women in Western countries. So for Chinese women in America, after they migrate to America, the chance of getting breast cancer, that's increased 60%.
Wow.
So the longer they stay in the Western countries, the more chance we get breast cancer. It's more to do with the lifestyle and the food.
Yeah.
And the food, yeah. But we don't have the data about their stage of disease when it's discovered for Chinese Australian. But the data we got in America is when they present the breast symptom, I mean the breast cancer is more likely to be in later stage because they don't go for screening. Yeah. Yeah. So that's why in the booklets we emphasize the point is, yes, breast cancer may not be the health issues in Hong Kong or in China. Actually, the incidence rate is really low in China. Yeah, the chance of getting breast cancer in China, the women in China is 1 in 26. In Hong Kong is 1 in 17. In here, it's 1 in 8 or in 9. It's much lower in there. But the longer we stay in the Western country, the more chance we get breast cancer. So this is one of the messages we emphasize in the booklets. Yeah.
But can I just ask with that, how much do we know about the incidence of breast cancer in China? Knowing that, there are women in rural areas who may have difficulties getting to these services and that, these kind of... Yeah.
We don't have screening. We don't have mammogram in Hong Kong or in China because breast cancer is not our health concern, honest. Yeah, it's common, but it's not our health concern. And also the statistics in China I find is really interesting is you find that women in the rural area, the incidence is really, really low compared to the cities. Because breast cancer, in terms we call is a Western women's disease, honest. Yeah, it's more to do with the Western lifestyles.
Interesting.
Yeah. But I think it's very fair. In Hong Kong, the cancer, the cancer that's common to our population, which is stomach cancer, NPC, the nasopharyngeal, that I never seen in Australia, but it's common in Hong Kong Chinese, or in China, or in China. Liver cancer, stomach cancer, esophagus, and the NPC. And it's quite rare in the local populations.
About dispelling myths versus what is a cultural core belief. Because, I can't really explain this very well, but to my mind, they're quite different things. So a core belief, something that is held across the whole of the culture, versus just some myths that are out there that are misleading. So to what extent are you having to deal with it being simply a myth that is about educating people versus a kind of a strongly held core cultural belief?
Yep, I get your points. So for example, in our Chinese, as I mentioned, when we feel well, healthy, no signs and symptoms, we don't think of disease. But that is very, different from the biomedical models. Okay, so when you feel healthy, you still need to, that is your responsibility to go for screening, for early detections. Okay, so that is the cultural belief, cultural health belief that we embed, since we were born. Okay, so that's why in the educational booklets we emphasize the point is how important of the early detections and what is the impact of early detections on the cancer treatment. So it's a cycle, as they believe once you got cancer, it's a death sentence. It's no cure or no treatment. Okay, so in here we emphasize the point, if you detect early, it have a huge impact on the cancer treatment and have a positive impact on the survival. Yeah, but the myth, for example, they believe breast cancer is only happens to the Caucasian women. So that's why we have the cancer, Chinese cancer survivors present in the seminar to emphasize the concept that yes, breast cancer can happen in our Chinese. Yeah. And I always quote, my family's experience, as my mom got breast cancer when I was 4. Yeah. Yeah, and and then I share with them about in the old days we don't have screening. So when my mom got the breast cancer, it's already in the late stage, and then struggle for 5 years and then pass away. Yeah, and that is they associate their belief, breast cancer can happen in the Chinese community. Yeah, in the old days and now as well. Yeah. Mm.
Is that why you had some of the difficulties with the Cancer Council? In terms of putting the information together, because of that conflict with what is culturally sensitive.
Correct, and also we found what the local cancer association does is they just translate the local message, literally into Chinese. It doesn't fit into our belief. As for example, you talk about risk factor, we never have risk in our concept. We don't think that is risk. We don't believe that, because I give you an example. Yeah, my dad, he loved to eat salty fish. I'm not sure if you know what is it. It's a carcinogenic things, for NPC. It's well known. But that will say, or that old generation, they will say, see, I'm 90 years old. I'm still here. I've been, drinking and smoking for 60 years. I'm still here. So when you talk about risk, for example, you said, don't smoke, and then you get lung cancer, it doesn't fit into our belief. It doesn't work in us because we don't have that risk system in our belief. Yeah. So it's no point. It's not effective. Just direct translate the current message into Chinese. It doesn't come into our belief system. That's why we always say, we need to have culturally sensitive, message for different ethnic groups. Yeah.
How did you go about validating your questionnaire then, with bearing that in mind?
Yeah, good points, yes. So as I said, the questions I used for this project is from my instrument development. So that one already well validated, with 700 Chinese Australian women and 700 Chinese women in Hong Kong. So that questionnaire, is already well validated and well published. Yeah, and as I mentioned, all these questions in the questionnaire is from my qualitative studies, and then design a questionnaire and instrument, and then it's now already well validated, well established. Yeah.
Can I have a question from Rhonda here?
Yep.
It's via email. Has there been follow-up on behavior change by determining who has had a pap smear or mammogram for the first time as a result of the education? Yeah,
thanks Rhonda for the questions, and that is what I'm thinking, that may be the next step to conduct a bigger longitudinal studies. Because of limited resources, the fundings and the time we shrink. So in this project we haven't done it, but I think that is the long-term goal for the next project. To have maybe 12 months follow-up or 6 months follow-up. Yeah.